Hello there. Welcome to K Vision Podcast. So this is your podcast to listen to for everything eye health and well-being. My name is Miss Khanam, your host, and I surgeon of K Vision Podcast and K Vision Center. And today is our season 3, episode 2, and we are celebrating patient journey and patient stories. I have a special guest with me today, Juliette Sinclaire Spence, and she is joining us from Netherlands, and she is a patient advocate herself for Acanthamoeba keratitis, a topic we're going to be discussing today, and also the founder of AK Foundation. Welcome, Juliette.
Thank you, Tina, for having me and inviting me to be here. As you mentioned, my name is Juliette Sinclaire Spence, and I describe myself as an AK warrior because that's the way we patients refer to each other. But as you say, patient advocate and the founder of the Acanthamoeba Keratitis Eye Foundation.
Yeah, it's an amazing work you've been doing. So the foundation has been up and running for a good few years now.
Yeah, I've created the foundation in 2022.
Yeah.
And it came because after going through AK, the lack of information,
Yeah.
support, and especially prevention,
Yeah.
it I needed to do something about it because nobody should go through this alone. And if it can be prevented,
Yeah.
it's the best because you don't want anybody going through this horrible eye disease.
Yeah. That,
And And I was saying, last but not least, bringing the patient perspective to the healthcare professionals because AK is not just an eye infection. We need much more than just a treatment for the eye. So it's about pain management, psychological support, and many more. So yeah, it's a whole combo trying to
yeah.
put
So
it on the table.
before we get into your personal story into AK and how it affected you, for our listeners, acanthamoeba keratitis is an eye infection, as Juliette said, and acanthamoeba is a small amoeba, a small microorganism that lives in our domestic source of water, so your tap water, your swimming pools, and your soil and your air is everywhere. So this amoeba gets into your front surface of your eye, that's the clear window of your eye, the cornea, and it can penetrate through if there's micro barriers and um, you know, breakdown of barriers of that corneal epithelial layer, the top layer. And it can cause devastating infection, very painful infection, and can cause blindness. So please share with us, Juliette, your story. How did this happen? How were you a AK sufferer?
Well, I've been wearing contact lenses since I was 9 years old, and I started with hard lenses and then switched to soft ones.
Yeah.
And back then, no one ever told me about contact lens and water don't mix.
Mm.
Like many people, we wore lenses for comfort and appearance. So that was the aim of it. Fast forward in 2016, I went swimming with my contact lenses, and because they were monthly, I said, okay, I need to swap them. I'm just dipping in the swimming pool, and I'm going to open my eyes under the water to see if I can see because I never opened my eyes under the water. So I did that, but I ended up coming with a unexpected visitor, which was the amoeba.
Yeah.
And what, and after a while, you start feeling something in your eye, but because I was a mom of two young kids, 2 and 6 years old, you think and that's many contact lens users, we have it. Oh, it's nothing. It will go away. Oh, I'm tired. It will go away.
Yeah.
So that's one of the main errors we do have. And then I started having pain and not being able to wear the contact lenses, tearing a lot. So I went to in Holland, you go to your general practitioner
Yeah.
who checked my eye and say you're going to the hospital, which means Houston, you got a problem because they don't send you that quick to the hospital.
Yeah.
And it took them, I was first misdiagnosed as bacterial infection and got lucky antibiotics and not steroids.
Yeah.
And after 1 week, the pain was so excruciating that I ended up on a cornea specialist who took 2 weeks to diagnose me. And that was thanks to a confocal scanner. And so we started the treatment, but 2 weeks later, I had to have an emergency therapeutic cornea transplant because the treatment was not working. And with the infection was on the stroma of my eye already. So there was not much to do, let's put it this way. But the cornea transplants, I always say, not only save my sight and my eye, but save my life
Yeah.
because the pain is so excruciating that you want to pull your eye with a fork
Wow.
and hide. So after the cornea transplant was meant to be temporary, um, and I'm the lucky one that 8 years later, I'm still honoring that tissue. And let's put it this way, I had to drop still after the cornea transplant for 16 months. I do say I'm a AK free, but nobody can guarantee that because if there is a cyst still in hibernating mode, they can wake up. And to the day, I'm not, the infection is not active, but I do have light sensitivity. That's why I wear a cap. I have trigeminal nerve pain 24/7. I have the depression. I have PTSD. I'm afraid of water around my eyes. So, as I always say, AK is not just during the infection, it affects you, but you have the aftermath after it that you can carry for the rest of your life.
Yeah, there's so much there, Juliet. Well, thank you very much for being so brave, sharing all of that with us. So,
Yeah, you're welcome.
yeah, let's unpack when you're wearing contact lenses and the hygiene, contact lens hygiene work that a lot of us have been involved in advocating. There was great work and foundation research done by John Dart and his team and Nicole Khan, raising the awareness that domestic water source is where the Acanthamoeba is getting into your contact lens and into your eye. And talk to us about what kind of lens hygiene you understood as a long-term contact lens user.
Um, well, before I go into the contact lens hygiene, I think it's important for the people who's listening to this that when it comes to contact lenses, the first thing they need to know is they are medical devices. So they must be prescribed by professionals and bought from licensed sources.
Yeah.
Because I know some people will say, yeah, but there is more cheap, or you know what, but don't risk it. Don't put your eyes at risk because it's not worth it. About the hygiene, this is a tricky one because when you are given contact lenses, they tell you, okay, how to clean them
Yeah.
with the official solution. You need to store them in the official solution, so don't tip it up. Always new, fresh solution. Wash your hands and replace them every X time, depending on the type of contact lens you're wearing, also your casing.
Yeah.
But they've never ever say clearly no water. Or
Mm.
the,
Yeah.
so many cases are happening because contact lens users are not aware that contact lens and water don't mix.
Yeah. Yeah.
And when we talk about it, as you mentioned, Nicole Kant, okay, there is this logo sticker for contact lenses that was created by Irene Atkinson in the UK,
Yeah.
which is like the tap water icon,
Yes.
forbidden.
Yeah.
And it has been shown that it does not clearly transcribe the message of what it means because people say, okay, it's tap water. What does it mean? So there is a lack of information, of clear understanding for the contact lens users that what it means is please do not shower, no swim, no do water sports while wearing contact lenses. If you wash, do please dry your hands. And of course, they might be wet from the solution, but not from water.
Yeah.
And never rinse them or store them in water.
Yeah.
I
Yes.
mean, that is really And it's so hurtful to see. I mean, I nearly have 700 members in the support group,
Mm.
and they are older. I mean, older, sorry, I'm older also because I'm plus 50s. But you see older generations that they say, we were never told not to shower, not to swim. And one of the things that we believe is happening is not only because of the earth warming,
Yeah,
that the waters are warmer, so it's a paradise for the parasite, but the material of the contact lens
yeah.
is different because they make them so they can breathe or absorb better.
Mm.
So that's when the amoeba sticks to the contact lens because it's easy and have the time to sneak in your eye and start eating your eye. Sorry for the
Yeah.
words, but that is really what is happening when we get an amoeba in our eye. They are eating our eye, and that's the pain we're experiencing.
Exactly, exactly. Now you bring out really good points. The tap with the no tap use,
Yeah,
you know, was thought to be quite important in getting that message out there that you shouldn't mix tap water when using contact lens. What is
yeah,
not clear, you shouldn't go swimming in them on because
yeah,
swimming water has amoeba and shower water has amoeba. And if you wash your hands, dry it because that water that you've got on your hand after you washed it will also have amoeba. So all of those things, we need to be a bit more detailed in our education and awareness of patients, absolutely. The second point that I want to explore with you is this excruciating pain that you get with amoeba and why that is. With contact lens use, like you said, some of them are very absorbent, it lets the amoeba in. It requires the epithelium, the barrier of the window of your eye, to have micro breakage. So what we call them micro abrasions. So if you wear contact lens for a long time, if you let it dry, all those micro abrasions will be there. And that's perfect route for the amoeba to get in. So just, educating, our patients that we're not going to be wearing it for 16 hours a day. You're going to cause microabrasion if you wear it for 16 hours, no doubt. And there's a lot of, I did a post on how many hours you should wear contact lenses, soft daily disposable. I was advocating 8 to 10 hours, a working day. And I got quite a lot of backlash by contact lens providers who are saying, we provide bi-monthlies. Don't say that to our patients. But seriously, if you think about a living organism, a living structure like the cornea, it's been deprived of oxygen, even though it's supposed to let in a lot of oxygen permeability, you're still going to get those micro cuts and injury and micro abrasion for the amoeba to get in. So for me, I would not be happy with my patients using it for more than 8 to 10 hours per day. What are your thoughts on that?
Look, I'm really happy you mentioned this because this is not put on the table
Yeah.
because contact lens manufacturers do not want to declare openly what could be the effects of wearing contact lenses. I mean, it's what I say to people. I don't want you to stop wearing contact lenses
Oh, no.
because it's like people like with keratoconus, it's a
Yeah.
life-changing experience. So
Oh,
I'm not saying do not wear them. I'm just saying please do what you need to do to have a healthy journey with your contact lens.
yeah.
And it's true that when we're wearing contact lens, and also women with the nails, without knowing, we're doing little abrasions in our eyes while putting the contact lenses or not. So give them a rest. Give your eyes a rest. I mean, if you need to wear them because you have to work, fine, but try to give as much as possible a rest and wear glasses. It's not worth the risk. I mean, really, I took my eyes for granted and I pay for it. And I don't want anyone to pay for it.
Yeah, no, that is a really good message. Rest your eyes as much as you can
Yeah,
and switch it to glasses. If
yeah,
it doesn't work for you, then by all means explore vision correction surgery so you don't have to wear glasses. But if you do have to wear glasses and contact lens, be mindful of what you're subjecting your cornea to and your eye to.
yeah,
The reason why we get excruciating pain is another point that I want to bring out to our listeners. Cornea, the glassy part of the window of the eye, has the highest density of nerves compared to anywhere in the body. So if the amoeba eats at your nerve roots, it's going to be excruciatingly painful. And that's, please talk to us about how much pain you suffered through this infection.
Look, and if I get emotional, it's part of it because I always end up getting emotional when I'm talking about this. When
Please.
we talk about pain, I try to categorize in different levels. You have the eating pain, the amoeba eating your eye. You have the light sensitivity pain for the photophobia, which is extreme. You
Yeah,
have the aching pain due to the inflammation. You
yeah,
have the trigeminal nerve pain, which is what you're mentioning right now, because they're eating the ending of the nerves. And as I call it, the nerves start screaming nonstop. So during the infection, you have the nociceptive pain. And after the infection, you have the neuropathic pain. The pain is so excruciating. Look, I was on high level of dosage of pain management that you can take at home because I was not in the hospital. It
yeah,
didn't do a damn thing. It's desperate. You really want to. I mean, a man will describe it from the group. It's 11 out of 10. Nobody can understand the pain. And what it's powerless is when healthcare professionals like you see us,
yeah,
the clinical view of the eye does not correlate with the pain we are experiencing. So we are not believed.
yeah,
And that is so powerless because you're putting toxic drops in your eye to kill that amoeba,
yeah,
which is another pain we're experiencing, the burning pain due to the toxicity.
yeah.
And being in such excruciating pain, having to drops every hour, not being able to sleep. You need breathing space, and that breathing space is helping with the pain. Till today, I need to take 400 milligrams of nerve modulator a day
Oh,
because I still have trigeminal nerve pain.
mm,
And it's hurtful. It's people don't believe it. Many doctors don't understand the pain. And that's one of the things that we as a foundation want to advocate,
yeah.
which will be a dream, is to create a standard protocol for pain management with AK.
No, you're absolutely right. Thank you for sharing that. I mean, you're right. When we look as a health professional, when we look in the eye, it doesn't look as impressive as the pain. But the pain, it should be our first red flag. If the pain is so much that's not correlating with the, clinical signs and the examination, we should think of AK. And it's absolutely right. We need to have a protocol or a gamut of painkillers to offer to the patient because it's not to be underestimated. It's really awful. It just probably hell on earth, isn't it, when you have that?
No, I mean, look, when I was having it, I was in a fetal position, hidden in my bed in a room completely dark, wanting to, and again, sorry folks, pull it out with a fork. I just wanted to die. You cannot get the pain out, and then you are in that excruciating pain, and then you need to put the drops, which are toxic, again.
Yeah,
So no, no, it's
yeah. It's you wouldn't
it's
wish it on your enemy, this kind of pain. It's not.
no, it's really traumatic, and I do call myself lucky because lucky enough, within 1 month of diagnose,
Yeah,
I end up with a cornea transplant, which was a game changer for me.
yeah, exactly. And that's the other thing. The delay in diagnosis happens because we as doctors don't think about AK at the first instance. Like you were misdiagnosed with bacterial infection, which looks similar to AK until later on. And then people are misdiagnosed with viral infection, get steroid, which makes the amoeba even more powerful and it takes hold even more and then spreads even more and accelerates. So yeah, misdiagnosis and delay in diagnosis is a real feature in AK, and you probably suffered that as well at the beginning.
Well, I call myself lucky again. I mean, 80% of the diagnosed are misdiagnosed, and
Mm,
that's scary.
that is scary.
And it's taking within 3 weeks to 2 years sometimes.
Yeah.
Unfortunately, 48% from that 80% are diagnosed at herpes. That's when the steroids comes in.
Yes.
And that's when Houston, we got a problem because it might at the beginning feel, oh, I can breathe because my eye is not so inflamed to
Yeah.
let's stop the steroids.
Yeah.
The cysts wake up because they multiply and now the trophocytes are eating our eye.
Yeah.
So it's one of the things we realize. I mean, we know that for healthcare professional, it's really difficult because there's very similar presentation, clinical presentation for the, and unless you get the ring, then you say, okay, now we're talking about AK. Um, but it's really important from a foundation point of view,
Yeah.
and we want to advocate that you can't diagnose what you don't think of. So
Exactly.
you need to put AK on all healthcare professionals. If it's a contact lens user or someone with ocular trauma who has been in contact with contaminated water or any type of water,
Yeah.
please rule out AK.
Yeah. Exactly. I mean, this is a powerful message for all the doctors out there who look at patients with the red eyes. Think of AKs if it's contact lens user and the pain is outweighing whatever you're seeing in your slit lamp and your examination. That's very powerful message. Thank
Yeah,
you.
but you also need to, there are some cases which are scary that don't have pain.
Yeah. Oh, yeah.
Yeah, so you're like, okay, hold on, but this is normal. Yeah, but there's some people who don't have pain. I say, okay, so I would say if it's a contact lens user, has been in contact with water, and his eye is misbehaving, as I call it, and it's off,
Yeah.
just rule it out.
Yeah. That's it. You should always have that in your forefront. Could
Yeah,
this be AK? Could
yeah,
it be AK? And can I do my patient disservice if I don't think of AK?
exactly.
Definitely, definitely. The other thing I wanted to touch on is this post-infection phase, and the trigeminal nerve and the amoeba and the cyst hiding in the nerve roots and in the stroma that you talked about. And you mentioned confocal, which is a special diagnostic kit which can locate those cysts sitting in the stroma and in the nerve roots. Not every unit will have access to that, but we are very lucky because we have quite a few units in London and Moorfields that has confocal, and you can always reach out to your colleagues and get confocal done for your patient. That is a key investigation for all the AK patients. What are your views?
Um, you read my mind, and there are two sides of this story. One, I do call it the golden tool because it's painless to do. You don't need a scratching your eye to get a sample to diagnose.
Yeah.
You could get diagnosed within hours but of course you need to have a high expert technician to be able to understand the images they are reading because they're not that easy to read. And the tricky part of it is that, as you may know also, most of the confocal scanners is the HRTM3, which is by Heidelberg. And unfortunately, they stopped production.
Oh, it's so sad, isn't it?
And I've spoken with them a couple of weeks ago while I was in Germany in a conference.
Yeah.
And I even spoke with a gentleman who decided to stop the production for technical reasons and license, which I respect. And he said, look, we're going to try to provide support, technical support for the PCs for the coming 6 years, more or less.
Yeah.
But there's not going to be software support.
I know.
And I told him, this is the golden tool for us.
Yeah.
And I say and for researchers, because this is the one they use for doing research. So I wish there was something else there, that is painless, is and being able to diagnose at the moment, because time is of essence. Waiting 2 days or 1 week is out of the questions with AK. You can't. I
Yeah.
mean, we are doing it nowadays, but the
Yeah.
more time you wait, the deeper Well, the more they destroy and the deeper they get in the eye.
Yeah, true. Time is of the essence. You're almost fighting to get ahead of the amoeba until it eats his way through into the.
Yeah.
Yeah, it's really sad. I'm really, I was trained on the confocal in Moorfields, so we were all advocating, and fighting to say, why have you stopped production? So I'm hoping that the gap is in the market and someone clever will come along and build something to replace the one we're losing. But yeah, it's been a key diagnostic kit for a lot of the AKs that we've seen.
Yeah,
Yeah,
it is.
yeah. So we've now covered your patient journey from when you're using the contact lens and your journey through AK, your diagnosis. What about the treatment? In terms of the treatment, did you get the AK treatment after initial phase of antibiotics? How did that?
Yeah, I did get the non-standardized treatment. In my case, we were talking about um chlorhexidine and I never know that name because it's so the Brolene, well, the Brolene is a brand, but you know what I mean because it's so difficult to pronounce.
Juliette,
So that were my two main ATT
yeah,
drops together with antifungals and
yeah,
atropine for dilating the pupil to help with the pain.
yeah,
After the cornea transplant, Brolin was so aggressive on the eye that was destroying my stitches. So I
yeah.
had to be operated again to restitch the cornea.
Gosh, yeah,
That's when we did a second confocal scanner to rule, to confirm, okay, the eye looks calm, we can stop Brolin. And then we kept on chlorhexidine for 16 months.
yeah. Gosh, yeah. That's the other thing. You have to be committed to that treatment period. It's going to be a long period, isn't it, for our life?
Yeah, and it's what listeners need to know is the moment you diagnose, you're going to be doing drops every hour nonstop
Yes,
for it can vary from 3 days to 1 week to several weeks. It depends by the professional. It's crazy. There is no standard protocol. So depends on the professional, what he thinks or her is the best approach. So sometimes we, AK warriors, feel like trial and error. Okay, this doesn't work. Let's try something new. So it's this, yeah,
yeah,
that's another thing. It's discouraging because we're going to try this to see if this works. We don't need to hear that. We need an approach that say we're doing this to eradicate it as much as we can. And when we talk about treatments, as you may know, the there's a new drug approved by the European Medical Agency based on the ODAC trial and carried out by Dr. John Dart, um, who is the first official drug to treat acanthamoeba.
no, it's
But
been John's dream for many decades.
I know, and I don't know if you know this, but John is part of the foundation. He's an expert from the advisory board. He's been really, yeah, very kind and yeah, sharing his knowledge, which we appreciate and we acknowledge him because he has done a lot for the AK community. But is one thing is having the drug approved, and another thing is having the drug accessible to the patient.
Exactly, exactly.
And that is so powerless because as a patient, you do not understand
Yeah,
the intricity of what it happens once a drug is approved to when you can have it in your hands.
that's true. There's so many hoops you have to go through before that happens. Yeah.
Yeah.
So exciting things are coming. So we're going to get something specific, but it's not there yet. But hopefully sometime soon.
Yeah, hopefully.
Yes, we are getting there. So in terms of the corneal transplant, you said that you had been honoring the tissue for 8 years, and that's very good news. And how many of your AK warriors in your foundation has gone down to the stage where they needed corneal transplant?
To be honest, quite a lot. more or less, we end up more having people having a cornea transplant to help them regain vision. Um, when we have cases of people that they are cured in 6 months without any procedure, that is really an exception, and we're really happy for them.
Yeah,
But there are mostly a lot of people having perception wise, I cannot tell you now by head, but there is a lot, and especially also with cataract surgery. And but it's the approach. Each country has their own approach. I mean, of course, me having a cornea transplant within 4 weeks,
it's unheard of. It's very,
exactly.
very quick. Yeah,
But of course, my one was already on the stroma, so
yeah,
my infection was going on for a long time without me noticing.
yeah,
Um, but
yeah,
then you see people needing to have a cornea transplant because it's melting the
yes,
cornea because of the toxicity and infection.
yeah,
So, but of course, due to the tissue being from a donor,
yeah.
access to a cornea transplant
I know.
is not that easy depending on the country you are.
Exactly, exactly. Um, in the COVID time, I remember our waiting list for corneal transplant was 2 year plus. It's a little bit less now, but getting tissue so quickly is an exception. And just
I
for
mean,
now, you know a lot about eyes now, having been through the journey and through the infection. But for the listener, the stroma, when you said the infection was down in your stroma, the cornea, the window of your eye, has several layers. So the top layer is the epithelium, which is the microabrasion and injury we talked about with corneal contact lens. And then stroma is the deep layers, and that's where your infection got to before you had your corneal transplant. And when we talk about melting of the cornea, that means it's gone through the deeper layers and it's going to drill a hole in that melting area, just for the listeners. And this is serious stuff. You're gonna seriously lose the eye through blindness and infection and melting. So yeah, it's a great message and great work you're doing with the foundation. And
thank you.
for you to give us a headliner or a message, call for action to patients out there who wear contact lens or have.
Oh my God. Call for action. Look, remember they are medical devices. Always get them prescribed and purchased from professional sources. And most important, contact lens and water don't mix. No swimming, no showering, no sleeping in them,
Yeah,
no washing them. No, please. And I will always take the opportunity to say for healthcare professionals, please put AK on your radar.
yeah,
If contact lens users or trauma patient has been exposed to water, rule out AK before.
yeah,
And listen to your patient. The pain is real, and providing both medical and psychological support.
of course. Yeah,
And for the policymakers, I think this is very important. Help us make prevention part of policy. Contact lens boxes should have clear warnings. No water, no sleeping, no showering, no swimming.
yeah. There should be like
So
a sticker. Don't do these things or little.
yeah, it's like our logo here next to me, like
Yeah,
on the other
yeah,
side, sorry.
yeah. Those,
It's
they're good. Yeah, they're really good actually. Yeah, lovely.
so this would be because then you don't need to translate. It's easy to understand and it's cost efficient for the package. I used to work as a communication expert and I'm no longer, I dedicate myself 100% to the foundation. So that's where we are. And listen, please, AK is real. It might, they call it rare, but it's becoming more normal than rare lately. And we need to do something about it.
Yeah, definitely. So the first thing is the patient education. That's, people are being aware of this amoeba and the disease, and you're doing a great work for that. In
Thank you.
and
Tried my best.
yeah, in my local swimming pool where I go to, I still see just swimmers with contact lens, and I go crazy, and I tell them, but I don't know how much is getting through.
No, you know what I do? I show them a photo of my eye when I had the
Oh
infection.
gosh, okay.
No, and then they say, ow. And I say, okay.
Yeah,
That's AK. And I say, get goggles, prescribe goggles. Please don't. But you will have a lot of people that say it won't happen to me. And I say, okay.
I
But
know.
if we can prevent even one person from
Exactly.
getting AK, I'm
Yeah,
happy.
yeah,
So,
that's true. Yeah, there's this real myth. I've gotten away with it for, decades. It's not going to happen to me, but it could happen to you. That's the point.
yeah.
Yeah, yeah. Well, I've had such an honor listening to your journey and your pathway to AK warrior, being a warrior for AK and the foundation. And, thank you so much. It's been an honor to have you on our show and listening to your journey and your struggles with AK and how it's empowered you. You turned pain into power. So well done.
No, thank you, and thank you once again for having me. And as I said, if you're an AK warrior family or friend who knows someone with AK, we do have a support group. So please go to our website. If you are a healthcare professional, you want to understand the patient perspective, please go to our website. Contact lens user, we also have tips for you. We try to provide information for all different stakeholders, so in their own language, I mean, in their own easy language to read. And please remember, contact lens and water do not mix.
Well, thank you so much, listeners. So remember, tap water or domestic water and any water doesn't mix with your contact lens. And please don't go swimming with them on or shower with them in. And even sleeping with them on, that's also not very good. You don't want that medical device in your eye for 16 hours, 18 hours, and however many hours when you're sleeping, when you're not opening your eyes. So, with that, I thank Juliette for being in our show and thank you for listening. And hopefully, we'll see you in the next one. Thank you.
Thank you.